Hi, everybody. Hope you guys are all doing well. Thank you for joining us tonight. I'm Chana Ross. I'm the owner and a pelvic physiotherapist at Vital Physiotherapy and Wellness in Toronto. And I'm joined by my very dear friends, very smart colleague and co-pelvic health physiotherapist, Anita Lambert. And Anita is the owner and also the pelvic health physio at Holistic Health Physiotherapy in Peterborough. Hi, Anita.
Hey, Hannah.
How are you, my dear?
Good, good.
So today we're going to be talking about a topic that I think the two of us treat, let's call it fairly often, but for sure we see a very large caseload of these ladies. And we're going to be talking about diastasis recti. Or diastasis rectus abdominis. And it's a really important topic for, I think, women in general, but specifically for pelvic health physios, because there's such a pressure to just get your body back. And like, you know, I have a whole bunch of philosophical, things to say about this, but the reality is that your body goes through a lot. There are a lot of physical changes that happen during pregnancy. And a lot of women postpartum are, left wondering, like, why did this happen? And so we're going to answer those questions tonight, right? And like, I want to be clear that once you do have a baby, you are always postpartum. So we see women who have had babies, 6 weeks ago or 10 months ago or 20 years ago, and they can still we could still help rehabilitate from diastasis. Okay.
Yeah.
And like I think the two of us have spent a lot of time talking about expectations surrounding recovery from pregnancy and returning to exercise. And the reality is, like, our bodies go through a huge amount of changes during pregnancy. And we do need like a nice chunk of time postpartum to actually recover from the pregnancy. And then after, and that tends to be like that 6 to 8 week period, but we talked about that before. But after that 6 to 8 week period, that's when you can start to work with pelvic health physios and actually start to rehabilitate. Right? And that's what we're going to be talking about tonight. And so we're going to be answering all of your questions. We've actually got a ton of questions already about diastasis. And if you have any more, please feel free to jump in during our broadcast. Thank you, everybody who's joining us live. If you're seeing this a little bit later, you can still feel free to send Anita and I a message with all your questions, and we're happy to answer them.
Yeah, and so for those who are just joining us, welcome, say hello, let us know where you're from, and as Hannah mentioned, any questions that you have, we're happy to answer live, or if you're watching the replay, please feel free to post as well. Also share with other women that you know that we're talking about this topic, because so many women have questions about this, but there's not a lot of info out there, and you won't necessarily hear this from your care provider, so your doctor, your midwife. Either they don't necessarily have the information, or they may not have the most up-to-date information. So really, really key, share this with others as well. So let's jump in. So why don't we start with kind of right off the bat, what is diastasis recti?
So I think the biggest piece of misinformation is that people think that their ab muscles separate during pregnancy, and that does not happen. What happens is your six-pack muscles are held together by a really thick layer of connective tissue. And I like to liken it towards, like, if anybody's ever cleaned chickens before and you take the skin off and there's like that like kind of thin, filmy layer in between, that's called fascia. And if you think about that as a really thick, just a lot of that, and that's between your six-pack muscles. So you've got 3-pack here and a 3-pack here, and that makes your 6-pack muscle. The area between that is called your linea alba. And in the third trimester, it is totally normal and perfectly acceptable for that tissue to actually stretch, because you got to put your baby somewhere, right? Your body has to accommodate a growing baby. And what happens is, I think, what are our numbers, Anita? Like 99% of, like 97, like something very high. I'm misquoting, but
it depends. Like the research, so there is a study that says 100% of women in their third trimester, and then another one says 66%. Yeah. So I think Chana and I are both on the same page in terms of most women we see in the third trimester have it to a degree. And Chana will talk more about what it is and the fact of just to know there's varying degrees of diastasis. So just because you have it doesn't mean everyone's diastasis will look the same or present the same. So
right.
Yeah.
And so basically when somebody comes to us with a, worry that they have diastasis, during the first 6 to 8 weeks postpartum is when that tissue would naturally kind of come back together. So if you think about the rest of your body during pregnancy, and then like your uterus kind of shrinks back down, that's how your tissue would naturally return during the first 6 to 8 weeks approximately. Clinically, we see that sometimes it's a little bit longer, but our research on the stretching of the abdominals specifically says 6 to 8 weeks is when that would naturally happen. And if those two pieces, if the two sides of the abdominal wall, but specifically the tissue between it, doesn't regain kind of its tension and its thickness, I like to think about it as thickness, then we start to treat and rehabilitate the diastasis. The thing is this, everybody is different. And I think this is a recurring theme for everything that we talk about. There are so many factors in diastasis and how you rehabilitate. I've seen women who have had 12 babies and their body just bounces back. They have the most amazing genes. You have, I'm like, what are you drinking? I'm going to take some of that. That's beautiful. Genes play a huge factor. Some women are just genetically predisposed to a little bit of their tissue doesn't have that same give, For me, I'm really, we'll call it petite. I like sometimes say like child size, but whatever works for you. I don't have a huge long torso. So when I had my babies, there was nowhere to go but a stretch. Like women who are petite are more likely to have diastasis because that's how their body accommodates this growing baby. We know that the number of pregnancies has an effect on on your diastasis. So, and how close together your pregnancies are as well, right? How much time has your body had to recover? There's a certain amount of elasticity to that tissue. It's not the same as an elastic band, but there's a certain amount of elastic property. And so I think about like after I wear a hair elastic for a certain amount of time, the first couple times you wear it, you wrap it around 2 or 3 times. But as when it becomes your favorite hair elastic, you eventually are wrapping it 3, 4, 5 times. It does lose some of that connective, that strength, that tensile strength after a certain point. And that's very similar for our bodies in pregnancy.
And and I think it's really good, Chana, that you mentioned about there's so many different factors and it's not to say that one is always going to cause it, right? Like I've seen some women who've had twins and they've had a really great in terms of diastasis recovery. And other women who've had one baby and it wasn't necessarily considered a quote unquote big baby or any of the things that you would think would maybe not think it would predispose them to having a diastasis. And then they actually have a diastasis that it takes longer to recover from. So really, if you're watching this, just know there's not one specific thing that will cause it or make it more difficult to recover. Hormones is another thing that plays a role.
Huge. So, and I think that there's a lot of misinformation surrounding, how do we assess the diastasis? A lot of people talk about the interecti distance, so sort of how far apart the abs are from each other. And we're really trying to move away from that. I know that I assess, and I know that you would assess also, Anita, in terms of the depth. So how far down basically does your hand go between the abs before you start to get some kickback, before you feel that tissue underneath you. And I'll demonstrate that in just a second. But I do want to point out also that, everybody's like, is it mild? Is it moderate? Like, how bad is my diastasis? That has absolutely no bearing on your recovery. like, again, I've rehabilitated people with like, who have had a 7-finger gap and their hand was sinking in and they are back doing everything they wanted to do before. I feel like we get very caught up in how far apart our fingers are, how bad our diastasis is. And really, I want to really emphasize this is a totally normal part of rehabilitating from pregnancy. I think that we're going to talk about this a little bit more later on, but the muscles that are involved in rehabilitating your diastasis are the same muscles that we use when we rehabilitate anyhow postpartum. So it's kind of a bang for your buck kind of situation where you're going to, this whole focus on diastasis specifically, like I want to sort of, shift the focus and say like, we just need to rehabilitate. Every woman should see a pelvic health physio is my point.
Yeah. And you may be having other symptoms. So we see a lot of women coming in, right, who have leakage, incontinence, or
other
pelvic physio. And all this information that is, even though we're addressing your incontinence or pelvic pain, it's also going to be addressing your diastasis as well, and vice versa.
Like these, there's kind of the beauty of pelvic health is that you can't treat one without treating the other. So there are a lot of questions. We received a lot of questions about how to assess. I'm going to very awkwardly adjust my position right now and show you how we assess. What I want to say is assess between the finger width and the depth of the diastasis. But what I want to say about the finger width is we actually don't know how far apart most people's abs are prenatally. So assessing how far apart they are postpartum is not really giving us very much information. What we do know is before you had babies, you were not able to stick your fingers down between your two abs, and that gives us more information. Okay, so I'm going to demonstrate for you, and if you want to give me some, you want me to be my Vanna White and describe what I'm doing.
I will talk through.
I'm going to take out my earphones, so it might be a brief moment of not so much fun. Hold on.
So Hannah's going to go ahead at how we assess for diastasis, how a lot of professionals will. But it's important to note this is one way to assess, but then also we do assess diastasis in different positions. So in squats and lunges or whatever your goals are, we want to check if you can create that tension in those different movements, or for example, like a plank. So this is just kind of the basic way that you will get assessed, but it's important to note we do assess in other ways.
Can you hear me okay there?
Yes.
Okay. So what I'm going to do is I'm going to find my belly button. I'm going to take my hands and I'm going to put it horizontally. So I don't want it like this. I want it like this. And I place my hand gently in my belly button. And I ask my clients to first chin tuck and then slowly raise their head up. What I'm feeling for here is at my belly button. I'm feeling, does my hand sink in? Is there a vast gap there? Or do I start to feel a little bit of kickback, the same way that I feel when I press on other areas on my tummy, that there's some gaps back there. I will always check about 2 inches above my belly button. Same thing, chin tuck and up. And I'll also check chin tuck and up below.
Okay? And the key thing is that we want everyone to know is it's a really slow head lift. So if you lift too fast and you go too high, you will miss. So your abs will come together really fast and you'll get kind of a false reading of that tissue in the center. So kind of the depth.
That first point where you feel your fingers.
So really slow. And if you're not sure you feel it, then put both hands and go that way. Because it could be that if you're trying with 2 or 3 fingers, it could be that your diastasis is wider. So you're not going to feel it come to the sides come together, and you won't get a good reading of the depth per se. So in terms of
that depth that we're looking for, how do you assess depth, Anita?
So in terms of I'm basically assessing, is there tension or not? is what it is. So kind of that idea, if you think of a trampoline, when you're putting your fingers down, and check also even before lifting your head, just go down the center of your abdomen and feel what it feels like just when you're lying there.
Right.
So are you able to sink, or do you already feel like how Hannah was saying, a bit of kickback, or if you feel a bit like a trampoline, like you feel like some tissue you're getting some pushback from, and then do the really small and slow head lift, and then see if it's different.
And usually you're going to find around your belly button, there's going to be less, if you do actually have diastasis, it's usually the least amount of tension, or there is usually the least amount of tension around the belly button, and often more above and often more below. But we do see diastasis of all different shapes and sizes. Women who have a larger gap above their belly button than below, or larger below than above. And visually, when you look at the diastasis, you can often kind of predict how that's going to fit. Right?
And then we wanted to make sure not only to address kind of what diastasis is, but a lot of women have questions and wondering the difference between a hernia and a diastasis. Yeah. And Hannah, we had a particular question come in, right?
I'm going to read out, this is a question from Emily, and I'm so happy, Emily, that you asked us this, because I think what, most women assume that a hernia, what Emily sent in. She said, hello, 9 months postpartum with my second baby. And I also have
sorry, Hannah, can you reread that? Yeah, the sound went out a little bit.
I have to do everything around here. Okay, you ready? So she said, I have a small umbilical hernia that is not painful, and I also have a 3.
Oh, sorry, Hannah, your sound keeps going out. How about I'll read it from my end. We'll see if it's the same thing. Okay. So I am 9 months postpartum with my second baby. I have a small umbilical hernia that is not painful, and I also have a 3-finger gap. I've been working to heal my diastasis carefully but diligently and have seen very little progress. I'm wondering if I should be concerned with the hernia and how to heal my diastasis. I'm anxious to begin exercising again and just want to be sure my abdominals can handle the stress of exercise, which is a fantastic question. So Hannah, do you want to go into that one?
Yeah, so I'm going to start a little bit. Emily, when you have a hernia, it's an actual tear, it's an actual hole in that linea alba that we talked about. So while it is different and we can't actually heal the hernia with physio, the same principles apply. And we're going to talk about this in our next question. So I might is we have these 4 muscles that work together, our core 4 muscles, and they make up both of our inner stability system and our pressure system. And so with a hernia, you're going to be looking for similar things that you would, in terms of your restrictions in your exercises, as you would with the diastasis. So you're always kind of, when we're trying to progress you with your homework for diastasis, or you're trying to progress with your exercises, you're also always monitoring what your hernia is doing and what your diastasis is doing. And so I feel like saying, we're going to talk about this the whole time, Emily. Is there anything you want to add in here right now, Anita?
Yeah, and that being said too, especially because Emily mentioned it's small. So oftentimes with a small one, it's not necessarily felt. That sometimes the only way to see it is actually with an ultrasound. And not a therapeutic physiotherapy type of ultrasound, but with an imaging ultrasound where they can actually see it. So it is one of those things where to really get it diagnosed is the best way is with an ultrasound. And to see if anything's changed, often it would be with an ultrasound. But as Hannah, as you mentioned, it's the same. How we would address your diastasis, we would do the same thing with a hernia or without, as long as there's no issues, no pain or anything like that.
Right. And what I might say is as well that, Emily, I don't know if you're thinking about having it surgically repaired, or your doctor has mentioned having it surgically repaired. Surgical repair is the only way to heal an actual hernia. Some hernias are so small, they don't require surgical repair. And then we just treat it like a regular diastasis. again, the width of the diastasis isn't as important as the depth. And if you're finding that you can create tension, which we're going to talk about just after this, so then you're safe to continue and move forward with your exercises. It really is a case-by-case basis. But if you are feeling stuck, seek out a pelvic physio. And if you are not sure where to find one in your area, get in touch with Anita and I, and we will help you find one.
Yeah.
Okay. So this really brings us, Anita, to our next question. What do we do with diastasis? Like, how do we fix it?
So kind of the broad answer and the common answer is actually it depends. So just like any of the, if you've caught any of our other Facebook Lives when we talk about any core pelvic floor issues, every woman is an individual and has different factors affecting their diastasis. So while we would love to say that there's one protocol, exactly do A, B, C, and D, and it will heal your diastasis, unfortunately that doesn't actually exist because everyone's body and experience has been different. But the idea behind healing one is to be able to create that tension.
Right. Oh. Now we've lost your audio. Can you hear me now?
Yeah.
All right. She's back.
Yeah. Yeah. So in terms of creating that tension in that tissue is key during daily tasks and your goals. So if you want to get back to running and you have a diastasis, we want to make sure you can create tension in different exercises or movements that build up to running.
Right.
So you have that support. So we're first going to talk about, and if you've seen us before, you've heard us talk about the piston breath by Julie Weeb, who's a physio in the US. So just to give you an idea.
Again.
Yeah. Because that idea of the pressure system. So we have our diaphragm that lives under our ribs, and then we've got our pelvic floor.
She brought out the pelvis.
Yeah.
We knew it was going to happen.
Yeah. The pelvic floor, which lives at the bottom of our pelvis. So our diaphragm up here. So that idea of when you breathe in, your ribs should open. As your diaphragm lowers, your pelvic floor lowers. And as you exhale, you breathe out, your diaphragm lifts and your pelvic floor should lift. So that idea of a piston, like in a car, in terms of that, that's how it would move. So that idea, your diaphragm, pelvic floor, and then we have that deep corset muscle, your transverse abdominis that wraps around the center. And so as you breathe in, it expands, so your belly will go out slightly. And as you breathe out, then it also, in terms of, draws in slightly too. So we'll go over that idea. So if you take a deep breath in, even just place your hands on your ribs.
I'll move back again.
Hannah will demonstrate.
It might affect my audio, so.
So that inhale into the ribs. And then as you breathe out, you'll feel your ribs soften in. And then as you breathe in, do that again, inhale. Exhale, you're going to picture a blueberry at your vaginal opening and rectal opening. As you breathe out, you're going to grab both of them, draw them up and in. And then inhale, put your blueberries or your beans or whatever you're thinking about back down. So that's just, yeah. So Hannah will demonstrate there. So that inhale, you'll see her ribs, kind of her hand move away, her belly move out slightly. And as she exhales and she's picking up her blueberries or her beans, her belly softens in a little bit and her ribs soften in as well. So that's kind of the basic, you can call it the core breath by Belly's Inc. or piston breath by Julie Weeb. So that idea is how to get your deep core going. And the idea is, when you do that exhale, there would be that tension in that linea alba along the center. Right. So that's kind of that idea. But I wanted to make sure we talk about the different factors that need to be addressed before that.
Right. It's not quite that simple.
Yeah. So for some women, that's exactly where you would start, and then building that into other exercises after you get that. So kind of squats and lunges, bridges, or, you know, depending on what activity you want to go back to. Right. But some of the other things that might affect it. So we talked about those core muscles. So let's say your pelvic floor is really tense. And so for some women, if you're experiencing pain with intercourse, pain with inserting a tampon, with pelvic exams, that could be a sign that your pelvic floor is actually tense. And if it's tense, it's hard to actually activate it. You need to release it first.
Yeah.
So that idea, if you were to jump into that kind of activation type breath
Before
to address your
body's ready.
yeah, but you still had a tense pelvic floor, you may not get the results you're looking for. So if you were to see a pelvic health physio, they're able to look at all of the core muscles to let you know what to start with. So tension in your pelvic floor can be one issue to first address before. The other thing is if you've had a cesarean birth, so the idea of your scar, which generally sits right about here, and the different layers that have been kind of sutured up after having a cesarean birth, and that idea that there can be tension in those different layers. And so if you can see here, so see how your pelvic floor attaches up into that pubic bone as well, and that corset muscle I mentioned that wraps around also attaches into there, and your linea alba goes right down the center. So if there's tension there, that may be affecting how any of those muscles or any of the tissue works or activates or moves or stretches. So being sure to work on the scar can be another thing. So if you jump into kind of the activation side of things, but you have tension in your scar, again, you may not see the same results. Yeah. So those are kind of a couple of key things to address, but then also getting that really great breath. So some women, Chana and I both see, like end up going home and initially they're learning how to do that rib breath, right? Because a lot of women, when they deep breathe, it's all up here in the chest. And depending if we're seeing women soon postpartum, they're taking care of a baby. They've got so many things going on. Your body in general is healing. And then if you have other children as well, you're running after them. So
sprinkle on a couple more children.
Yeah, lots of stuff at once, right? So that idea that even just getting that breath back or getting your posture back. So that idea that Chana was showing earlier is the rib cage over the pelvis is really key kind of in that initial part of getting that really awesome rib breath, and then layering on whether you're releasing the pelvic floor or you're learning how to activate and release your pelvic floor. So even just getting the ribs stacked over the pelvis is another factor that sometimes is often missing, actually, I should say, because afterwards. If
you're not aligned, you can't access those muscles in the same way that you would otherwise, right?
Yeah. And that's where we start, is like a lot of women find that, and we see results and they see results of the ribs over the pelvis. But then eventually you don't want to always have to live in that posture, but initially, oftentimes, it's a great alignment to be in and be mindful of, to be able to engage. So those are some of the...
It's like any other kind of, any other thing that you're learning, right? You start off with the basics and then we build. Yeah. So a lot of what we're talking about even tonight is basics, but then it's our goal once you've kind of made these basics work for you.
Yes, and we'll also be mentioning, stay tuned till the end, we're going to be talking about some of our favorite resources. So these are online resources that you can check out to kind of get more information about that, or try different things and see how they work for you if you can't get in to see a pelvic physio. If you can see a pelvic health physio, or depending where you are in the world, pelvic physios can be called women's health physios, to see them, and they'll be able to really assess everything and really guide you individually on how to heal your diastasis. But sometimes if that's not an option, the resources that we'll be talking about at the end are kind of a great way that you can learn about it more and you can see individually what works for you too.
Yeah. It's all about the individual approach, my friends.
Yes. Yeah. And so anyone who's just joining us, please say hi and leave any questions as well. And because we'll be sure to answer them before we end tonight. So next, this is another common question. So what kind of exercises should I avoid if I have diastasis? So Chana, I'll send that to you.
Okay. We're going to start off with a disclaimer here on this one, because the answer is always, it depends. Historically, in the past 5 years, we've been saying, don't do sit-ups, don't do crunches, don't do V-sits. Like, we've had this whole long list of things that we can get. Can you hear me?
Can you go? Yeah, go back for a second, Chana. Sorry, everyone. We've had some sound difficulties today. But,
so the reality is that that there are a lot of women who feel like so strongly about doing sit-ups, and we can get them back to doing sit-ups if you care so much about it. There are women who they're like, I want a plank, and like, if you want a plank, we'll get you back to doing plank. But the basic theory is anything that kind of provokes your diastasis. So for some women, when they do that crunch, that curl up assessment, what you often see is like their abs kind of come up, and they do what we call dome. Okay. And so that's a sign that your muscles, that your linea alba is not doing what it needs to do, that you don't have tension in that area, in that exercise that you're doing, or in that movement that you're doing. And so and some other women, when they do that curl test, they get sort of like a little sinking in, they get a little valley there. And so it is our job as pelvic health physios to teach you how to engage those 4 muscles once your body is ready to do so, and train you how to properly engage them, and when you're doing the exercise that you want to do. So what should you not do? You should not breath hold. These 4 muscles work with breath. So when you take a breath in, your diaphragm moves down, your pelvic floor descends, and as you exhale, your pelvic floor springs back up and engages your inner abs and inner back muscles. If you're holding your breath, that's not happening. So a lot of women, when you're watching them, they're just breath holding while they're doing their exercise, and that's why these muscles can't engage together. What else should you not do? I'll tell you what you shouldn't do. Can you hear me still? You shouldn't stand like this, right? Because what this is doing, again, if you think about these 4 muscles pushing pressure forward into that front wall of your abdomen, that isn't getting that same tension that we want right now. So equalizing the pressures by doing exactly what Anita said, ribs over pelvis, right away you're setting yourself up for those muscles to work optimally, and you are not if you're standing in we'll call it the non-optimal way. That being said, I totally think that you should be able to move back and forth with your body, but again, while you're learning how to do these exercises and you're training these muscles, let's train them so that they're able to be dynamic. The other thing that I want to talk about is the activate your core cue, which I love my gym. I love going to the gym. It's everywhere. It's everywhere. There is a lot of, holding your core. And we know that when you're gripping your abs, these 4 muscles to work together, you are just squishing that center of your pressure system, causing pressure to go up and pressure to go down, and you're actually not allowing the system that's actually going to help you recover from that rectus diastasis to recover. You're actually preventing that from being able to functionally be used functionally. So I don't actually talk about exercises not to do. I say, listen to your body. Are you noticing a doming when you're doing an exercise? Are you noticing that sinking down? Once you kind of understand in that linea alba, in the space between your 2 ab muscles, once you understand that, do you feel that tension while you're doing those exercises? And so I kind of stay away from what not to do and just really focus on what can we do? And you know what? What do you want to do? And that's going to direct us.
Yeah. And I think breath holding is huge, because especially things like planks, I have some women that, that's one of their goals. And as we start to get back into it, and then we bring planks into to kind of their home program and getting back to those goals, they totally realize right away, they're like, oh my gosh, I was holding my breath like when I've done planks forever, right? So it's key. And then women getting back to running, it's going to be impossible to think of engage, release your core. It's just, it's not realistic, right? Yeah. But breathing, I'll have women when they're running to just check in with their breath. Is their breath going into their ribs or is it more into their chest? So if they can just do random breaths while they're running to see, you know, where is my breath going? If it's more than likely going into the ribs, then likely, you know what, things are fine in terms of that inner core system. So the breath is really, really huge. And a lot of people don't really think about the diaphragm or the breath being part of their core. I'm sure, Chana, you're the same. Whenever I start talking about the breath, and that's where I go to first, a lot of women are like, oh, I had no idea that this had anything to do with my pelvic floor or my diastasis. So, and
it has to do with your lymphatic system. It has to do with so many, like it has to do with your respiratory system, obviously. It has to do with your cardiovascular system, your nervous system. It's like breathing is, you know, it sounds stupid, but once you're breathing, you're doing exactly what you need to do, right? Have a little joiner here. And I want to go back to that hernia question because that's my husband, everybody. Because once you start to be aware of what does your hernia feel like, or can you feel it coming out? Can you feel it? If it was painful, which it's not for Emily, but you know, once you start to be aware of your hernia, that's a really awesome way for you to check, can I move forward with this exercise? And sometimes, let's go back to plank. Sometimes you start to feel like there's coning, or there's the doming, or that you start to feel like that sort of divide, or that you can't maintain tension when you're on your elbows and your feet. But if we could take it back a step and go onto your elbows and your knees, or we can go into, you know, hands and knees, and then sort of do a little hover. Like, there are so many things that you can do. You can take everything, you can modify everything until you're ready to move forward with it. And you just keep kind of checking in with your body to see what it is that you need.
Totally. Yeah.
And so I think we keep kind of talking about this, but you know, another common myth is that all you got to do is Kegel and your abs are going to be flat. So when it comes to recovery from diastasis, a lot of women think that once your diastasis is rehabilitated, your abs are going to be flat. Is that true, Anita?
Yeah. So it's one of those depends, yes and no. So there's a lot of different factors involved. So the other thing too is mentioning that just doing Kegels won't flatten your abs, because if you're just doing pelvic floor work, it's not necessarily affecting your transverse abdominis or creating that tension. So you want to make sure that deep core system we've talked about a few times is all working and creating that tension. But still, there's so many other factors in terms of what the abdomen looks like. So depending in terms of, like I mentioned with that cesarean scar, if that's here and there's tension there, that can create in terms of almost like a little bit of a ledge in terms of the abdomen if there's tension there. Another thing too is during pregnancy that a lot of us in terms of adipose tissue, however you want to talk about it, in terms of we gain fat, we gain other tissue in our body in general, and often that can be around the abdomen as well. And there's a purpose for that, right? While you're growing a baby, there's a purpose for that. And so yes, and that's another side of it, right? That can affect it, but also skin stretching, right? In terms of that, you think how far your abdomen stretched, and that idea that the skin to a degree will, in terms of how Chana talked about the elasticity, but everyone's going to be different in terms of how much that comes back. So that can also be part of kind of what your diaphragm looks like. So lots of different reasons, but then also Chana talked about that posture. So if your ribs live behind your pelvis, it can create that idea that your abdomen looks like it's sitting out farther than it is. As soon as you stack your ribs, it actually changes the profile or the look of your abdomen too. And then the other side is bloating, or just in terms of looking at the digestion side of things. So if you have IBS or any issues with digestion, pelvic health physios do address in terms of talking about hydration and nutrition and that, but also seeing either a naturopath or a nutritionist as well as part of your team.
Yep,
can be really helpful to address that side of things. So there's a lot of different reasons of why your abdomen may look a certain way, even after your diastasis heals. That just healing your diastasis does not guarantee you're going to have this flat stomach. Your abdomen has healed, but there's a lot of other different factors involved.
Totally. And I think that we do get this question a lot. And so a lot of women are like, okay, like at what point do I then need to have an abdominoplasty? And we actually kind of hemmed and hawed on whether or not we were actually even going to discuss this tonight, because I know in my practice, like an abdominoplasty is not even, in my mind, kind of on the table, because it doesn't heal your diastasis, right? Like an abdominoplasty flattens your tummy, but it doesn't actually bring the two sides of the abdomen and help you regain function. What is your general rule of thumb with chatting about surgical repair?
Yeah, so like the idea, so kind of what people might think of it, so a tummy tuck, so what Hannah was talking about. So again, that's just kind of addressing kind of extra skin, extra tissue, and they're not necessarily affecting what's going on with the diastasis. So to actually have a surgery,
different layers of the diastasis, sometimes it's first, but not. Anyway.
Yeah. So oftentimes it's, with women I see, it's kind of based on tension. So this idea of doing everything they can to learn how to activate the core, the four muscles that we talked about, creating that tension. And sometimes for some women, they can engage those four muscles. So your diaphragm and your pelvic floor and your transverse abdominis and your multifidus along your spine. But yet, despite that, tension in that tissue in between doesn't necessarily happen. And so in that case, if they've worked on that for a really long time, all the muscles are working.
What's a long time to you?
So depending, so usually it's about a year that women will be working on, and some women, and it really is based on them, right? In terms of if a woman is willing to work beyond that on it, then that's totally fine. So it's really working with their goals. And some women don't want to work on it that long. So it's just one of those things that it's an individual basis, but generally it's based around tension. So if you can create tension along that center, surgery isn't necessarily something that you would need to regain function or to get back to your daily tasks. But then the other thing is, what are your goals? If you do really want that flat abdomen, and despite working on everything, that doesn't happen, then maybe surgery is something that you want to look into because of those other reasons. So there's so many different factors, but yeah, something that we just wanted women to understand is like having a tummy tuck doesn't necessarily address the diastasis.
Yeah, absolutely. So we have a whole bunch of really great resources.
Hannah, do you want to talk about the first couple?
Yeah. So, I mean, we keep chatting about her. We're big fans. Julie Weeb has some amazing. She had some courses and, sort of like how-tos for with exercises on how to recover from diastasis. She talks about alignment and the piston breath and all that kind of stuff. And it's really very easy to understand and useful, and we love it. And another great resource is Belly Zinc, and they they are training personal trainers about pelvic health, and they have an amazing list of personal trainers on their website, so that if you are looking to work out with somebody, you can sort of cross-reference and see, do they have this Belly Zinc certification, and they are, then you can sort of breathe with a sigh of release that like, okay, like I know that this person knows what they're talking about, so that you're not. And they also have some great, they sell some great exercise sort of protocols for the different stages of pregnancy and postpartum for diastasis specifically. Anita?
Yeah.
Who else? So
there's 3 particular prenatal and postpartum fitness instructors who educate other trainers, but also have amazing resources for moms and moms-to-be, and I highly recommend following all of them on social media and finding them online and checking out their courses as well. So Jessie Mundell, she's here in Canada, and then Brianna Battles, so her website is everyday-battles.com, and then Jen Campbell, who's also from Canada, and she's at mamalionstrong.com. So we're going to be putting all of the resources in the comments afterwards, so you can go and check all of them out. They're all worth following on social media, have great information to share. And then again, those resources we said to check out for yourselves online.
And if anybody has other resources that they love, then let us know, and we'll be happy. That we were a little bit not quite so tech savvy today. I'm noticing a whole bunch of comments are actually coming in now that we're surrounded. So our apologies if we didn't get to you through the live show. We will respond to all of you guys. We'll answer all your questions. Maybe a little belated, but we'll get there.
And then also we wanted to mention, similar to last time, so a website, if you're looking for a public health physiotherapist in Canada, so publichealthsolutions.ca has a great spot that you can find public health physiotherapists that have been trained through that company, and many of us in Canada have.
And if you're in the US and you need some help finding a public physio, again, you can message us and we will help you find a public health physio.
And then also we want to let you know what our next Facebook Live will be on, because this has also been a question that's come up a lot lately. And June was actually Prolapse Awareness Month. So we wanted to make sure our next one was addressing all your questions about prolapse. A lot of women have no idea what it is. And don't find out until they realize they have one themselves. So stay tuned for that. And everyone, Chana and I will be back to talk about all different public health and core topics during pregnancy and postpartum times of life. So,
and if you have any topics you would like us to cover so that you can recover, let us know as well. So Anita, how can people find you?
So you can always check out my website at holistichealthphysio.com. You can find me on Facebook or Instagram at Holistic Health Physio, or Twitter at holistic_physio. And I'm always happy to answer questions and share information, the same as Chana. So Chana, where can everyone find you?
You can find us on our website, vitalphysiotherapy.com. You can physiotherapy. And on Instagram, we are Vital Physiotherapy and Wellness. The "and" is written out. And we're so happy to answer questions and comments and respond to comments. And we really look forward to our next Facebook Live. We're going to be addressing pelvic organ prolapse. And we can't thank you all enough for joining us. And Anita, always a pleasure. And we look forward to seeing you guys next time.
Sounds
Have a good night. Bye, guys.
Bye.